37 union nurses at Mayo Clinic Austin just received 90-day layoff notices.
I just got laid off. I was laid off from my outpatient job and I was working in a NICU follow-up clinic.
Right on the heels of National Nurses Week, New York Presbyterian Hospital has announced its plans to lay off about 2% of its workforce, which equates to about 1,000 employees.
The job market is so bad, even nurses are getting fired. I thought they had some of the best job security in the world. I guess not. Let's take a look at some videos and see what's going on.
Big news out of Austin, Minnesota. 37 union nurses at Mayo Clinic Austin just received 90-day layoff notices. Mayo says it's because of low inpatient volume and operational changes, but let's unpack what's really happening here. These nurses are all members of the Minnesota Nurses Association, and they were given official WARN notices. So that's the legal requirement when employers plan mass layoffs. But the union isn't buying it. They're calling this a union-busting move, and they filed charges of unfair labor practices. So this comes from Mayo Clinic Health System, one of the most prestigious and wealthy healthcare brands in the country. So why are they cutting frontline staff? The very nurses that the patients depend on. So this isn't just a local issue. If you've been following my videos, it's part of a national trend. Hospitals are consolidating services, shifting care away from smaller community facilities like Mayo Austin, and in the process, cutting bedside staff, often while executive compensation keeps rising. Nurses have warned for years, safe staffing saves lives, but decisions like this send a clear message. Profits and efficiency are being prioritized over patient care and worker stability. So here's the question. Is this truly about declining volume, or is it about breaking the union and centralizing power? You decide. Let me know your take in the comments.
Even being part of a union doesn't protect you anymore. They're saying low patient volume, so suddenly everyone in the country got healthier? Come on, that doesn't make sense. No one believes that.
I just got laid off. I was laid off from my outpatient job and I was working in a NICU follow-up clinic. I have never experienced something like this before. So I'm doing what any sane person would do, which is I'm eating French fries, waiting to go into Hobby Lobby. I will say I'm very thankful that I work per diem. I do have a second job that I'll just pick up a little bit more at. I don't have benefits through this job, so I'm not taking a hit as much as a lot of the other nurses are, but whoa. I have a lot of feelings about this. I think the biggest one I'm feeling though is disappointment and I'm a little bit angry. This is the first time where I have seen with my own eyes that we treat healthcare like a business. It sucks because at the end of the day, the people who are suffering this layoff the most isn't me, it's not the nurses, although yes, we are suffering, it's the kids. And that's what I'm having such a hard time understanding is, why are we doing this when we know the detrimental impact it's going to have on the patients who are the children?
Cutting children's healthcare is diabolical. Who's in charge of these cuts? Why would anybody do this? When nurses start getting laid off, you know it's bad.
Right on the heels of National Nurses Week, New York Presbyterian Hospital has announced its plans to lay off about 2% of its workforce, which equates to about 1,000 employees. Don't know yet exactly what the breakdown of those employees is going to be, but we do know that it includes nurse practitioners and nurses. They are allegedly laying off all of their nurse practitioners except the ones that were hired before 2010 and have allegedly already laid off 50 RNs from the Columbia campus, from what I'm told. But are they not still building a new cancer center and like enlarging another hospital? But they're citing financial difficulties. Why? Why are they having financial difficulties? That's a great question. I'm glad you asked. Last week, Columbia University and New York Presbyterian Hospital announced that they have settled a massive class action lawsuit for $750 million involving 576 patients that have accused an OBGYN by the name of Dr. Robert Hayden of assaulting them between 1987 and 2012. But wait, it gets worse. According to federal investigators, Columbia University knew about this for years and years and continued to allow the OBGYN to work for years as patients continued to come forward. Finally, in 2020, federal investigators began investigating, and they have alleged that Columbia University failed to inform the DA when more patients continued to come forward and that they withheld evidence. And to date, as far as anyone knows, no one with Columbia University and New York Presbyterian, none of the employees there have been terminated or resigned in the wake of this. He was finally sentenced in 2023 to 20 years in federal prison, thank goodness. But Columbia University, they have not had to admit any fault whatsoever. But they're now paying out $750 million in settlements while they let him continue to do harm, to actively harm patients. And now, as the trickle-down effect, nurses and nurse practitioners and other healthcare professionals are being laid off. If that doesn't piss you off. The epitome of corruption. And this is not an isolated incident. Stuff like this happens all the time. They always cover it up, especially when it's a doctor.
So nurses are getting laid off because the doctor committed a crime. Shouldn't it be upper management who's responsible for this? Oh wait, of course not. They're not gonna fire themselves, especially not before they get their big bonus.
Hey guys, if you're wondering where I've been, well, I just got laid off from my work from home job. This was something that I absolutely did not expect nor was prepared for, so it came as a shock to me like it is to you right now. We were in a town hall meeting where they basically let everyone know that they were going to do a massive layoff. Mind you, the last town hall meeting before that, they were talking about the yearly bonuses and the salary increases, so coming from that, this was totally devastating. Their reasoning behind all this was due to the changes in the healthcare system in the government, which affected the budget, which means that they need to basically make some cuts to stay afloat. So the next day I saw that a meeting was scheduled on my calendar with HR and the AVP, which meant that I was getting laid off. It was exactly a 15-minute call, and I'm not gonna lie to you, but I felt like I zoned out during that call because I was still in denial with everything that was going on. I broke down in tears after the call, and I was just really upset. It's not like I've never been unemployed before, because I have in the past, but this time is a little bit different because it's someone else deciding that for me. Now that I've sent all the work equipment back and closed that chapter of the book, it's time to start a new journey, and that's looking for another remote job.
I didn't know work from home nurses were a thing. Can someone explain that to me? Nursing over Zoom is crazy. This comment says, just went through that, about 200 of us got laid off because they outsourced to India. We are all told on a Teams meeting. Outsourcing nursing to India? That's a thing? Even hospitals are trying to find every loophole not to pay insane amount of wages.
I don't know if your hospital is about to go through a major layoff or closure. 2 warning signs that you don't want to miss. Last week I reported there were up to 41 hospitals with major layoffs and closures. Now we're up to 51, and it's just a week later, halfway through July. Why this is important is because you don't want to be on your heels when they make this announcement. You can prepare ahead of time, get ahead of the curve. The first one is sneaky. Companies are going to offer an early retirement option. Yale just announced this yesterday. Not always, but most of the time, it decreases the amount that they have to reduce in force from a non-voluntary perspective. The second way of knowing if a company is about to lay off is you can always check the WARN notice list. This can vary state by state, but it basically provides several different stipulations that companies must issue. Kind of Google WARN, go to your state, click 2025, and then you can just scroll and it will literally tell you the letter and how many positions that they're expecting to lay off. Don't be caught unaware. Use this information to inform yourself, be prepared, get ready. Use this as a career transition to better yourself and your career and possibly your work-life balance.
What's worse is that some of these nurses might lose their pensions. They invested all of these years, and in the end, they're gonna get nothing.
So you met him in February, and in March he needed money.
Yes.
Okay. Ding-a-ling-a-ling-a-ling-a-ling-a-ling. That's a bill.
I thought there was a nursing shortage. Is the economy that bad?
Why doesn't anybody talk about how hard it is to show up to work after they announce that they're doing layoffs? Like, you expect me to show up and want to work every day at my hardest, even though you may turn around and just say, poof, your job's gone tomorrow? I don't know about y'all, but I have zero, probably negative motivation to show up for this company who every 6 to 12 months threatens layoffs. I'm fortunate that I haven't been laid off at this point, but it's really frustrating when your director's response is, well, you're a nurse. It's fine if you get laid off because you have so much opportunity. Hey there, Joe. No, I don't, because I would rather go stick my feet in a pool of alligators than go back to the bedside as a nurse. I don't know about any other nurses, but I feel like if you've been in it, you know what I mean. And once you've been out of it, you're not going back. So while yes, I have a nursing degree, if you've been ever a bedside nurse in the last 10 years, you know, there's no way I'm going back. So anywho, I don't know. I'm just feeling frustrated today and very unmotivated to work. And I just don't know if anybody else who gets threatened layoffs feels the same way. So if you've ever been threatened to be laid off, like, did you still show up 100% to work? Because it's not like it matters, right? Anyway, happy Wednesday.
This is such a difficult position to be in because on the one hand, you want to do the bare minimum because you don't want to feel taken advantage of by the hospital. But on the other hand, your patients' lives are at risk. This comment says, my husband is doing the job of 3 people. He is so burnt out. He is 60. He is getting ready to snap. Doing the job of 3 people? Yeah, these hospitals are getting out of hand. People are going to be dying.
Because of that, and the fact that the enterprise continually reassesses our workforce needs, I'm notifying you today that we need to reduce our staffing and your positions will be eliminated. I'm notifying you today, but however, you will be paid through the employment termination date, which is May 13th. Following our conversation today, you're going to be getting a lot more information, and I'm going to ask...
For them to put a bunch of people on a conference call, you know they're firing a ton of people. This comment says, this is why you never give notice when you quit. You know, sometimes you don't want to burn that bridge, especially in a career like nursing where there's only so many hospitals in an area. It's not like working at McDonald's where there's like 10 locations within a 2-mile radius. If you enjoyed the video, like and subscribe. Help me reach 1,000 subscribers. Let me know, what would you do? Are you giving a 2-week notice or are you just leaving out of the blue?